Hi guys, and welcome to another video. In this video we're going to learn about epilepsy and how to help people with seizures. So let's start. Okay, so first off, what is epilepsy? Epilepsy is a general name that we have for a group of disorders that cause people to have seizures. And what is a seizure? A seizure is when someone is having an increased electrical activity in their brain. So you can say that, in other words, when someone is having epilepsy, it means he's having a disruption in his brain activity. Now, an interesting thing about epilepsy is that it's not exactly what we think it is. Most people, when they imagine epilepsy, they imagine like a very movie-like seizure when a person drops to the floor and starts spasming uncontrollably, hitting his head. Now, it is true that this is one type of the seizures, but in fact, epilepsy can come in a lot of different ways. In fact, to this day, neurologists are still categorizing and updating the list of different seizures that people can have. Now, we're not going to cover all of them in this video, but I do want to mention two of them, as well as how they categorize them. So first off, how they categorize them. Neurologists usually categorize seizures into two different fields, or you can say parts, I guess. One is the partial seizure, and the other one is the generalized seizure. And what does that mean? Well, it means that some seizures only affect a part of the brain. So for example, this seizure, when a person falls to the ground and starts spasming, in some cases, he might only spasm with his right arm and right leg. It really depends. Not in all cases, the seizures affect all of the brain. While generalized seizures do affect all of the brain, and thus they affect all of the body. Now, there are two types of seizures that I think is important for us to learn about, and these are the petit mal and the grand mal. Now, you don't need to remember the names of these seizures, but I do want you guys to know about them. So first off, the petit mal. Petit mal is also called the absence seizure, and this is a seizure when someone suddenly disconnects. This was an example. I actually don't have epilepsy, but this is basically what happens. A person can be with us and he can disconnect for a few seconds. Now, these type of seizures, the thing about them is that the patient doesn't really know he disconnected. He doesn't remember that this happened. So it is a pretty interesting type of seizure. It doesn't need any special medical treatment. We don't need to you should obviously go to the doctor and get checked if this happens, but this is not something that needs a first aid type of help. We just can tell him that he had this kind of seizure, give him some space and let it pass. Usually it only lasts for a couple of seconds. If it does last for more than that, then it would be a good idea to call an ambulance and get some help. Now, the second type of seizure is the grand mal. This is that kind of seizure that we see in the movies where people fall to the ground, and this one does need our help as first aid providers. And what we want to do in a situation like this is, first off, if our patient is having a major seizure where he's falling to the ground and starts spasming, we want to make sure we first off call for help. In some cases, help is not needed. However, it's always better to call for help immediately. In worst case scenario, just cancel it instead of missing very precious time. As you guys remember, with first aid, we don't want to waste time. Now, second thing you want to do is you want to make sure that you pad the area around him, especially below his head. When a person falls to the ground and starts spasming, then he might hit his arms, his legs, and his head on the floor really hard. So we want to take off our jacket, our shirts, or anything that we can find, or maybe a tiny pillow if we're at home, and put it below his head and below his arms and legs, if we can, to make sure that he's not going to injure himself. Another thing that could really help is to move out of the way any objects. We don't want him hitting against different objects. If it's a table, a lamp, or anything like that, we should clear the area around him. Okay, and after we do that, next thing we want to do is to monitor his situation. While he is still unconscious and he is spasming, we don't want to touch him. However, we do want to monitor his state, and as soon as he stops spasming, if he is still unconscious, we would want to take care of his airway. As you guys remember, any person who is unconscious, we should worry about their airway. So in this situation, we would actually want to also look at the airway and clean it if we need to. So what we want to do is to open his airway, look inside. If we need to, we will clean it, and then we would keep his airway open. If he starts spasming again, we have to release him. We don't want to touch a patient who is spasming. And one last thing, guys, is you want to time his spasms. So as soon as he starts having an epilepsy attack, you should take your watch or your phone and you should press the timer and make sure that you notice how long it takes. You don't have to be very exact with a timer and look at how many seconds it takes. You can also look at how many minutes has passed. Look at the hour and remember it. And that way you can have an approximate. This is important because when help will arrive, it could help them to know if these spasms were more than 5 minutes, less than 5 minutes, if there were 3, if there were 7. It's very important to also keep track of that. But I would say the most important part is to cushion his head and make sure that we take care of him, that we monitor his situation, that we are there for him, and that when he wakes up, that we will calmly explain the situation to him and make sure that help is on the way. Now keep in mind, there are a few misconceptions about epilepsy and about what you should do, so I really want to tell you guys about this. There are 3 things that you should never do when a person is having an epilepsy attack. First thing is, you don't want to put anything in his mouth. Don't give him water, don't give him food, just don't put anything in his mouth. Second, if he's having an epilepsy attack, don't try to move him. You don't want to touch a person who is having a seizure, which brings me to my third point. Don't try to hold him down. There's this misconception that says that you need to hold him down so he will not hurt himself. You don't want to hold a person who is having spasms. Just let the epilepsy attack pass over. Okay, let it just go. You don't need to do anything like that. Just make sure that you pad around him and just wait until it passes. Now you're probably curious about what are the causes of epilepsy, what are the triggers. So there is obviously this one that all of us know from video games and movies where we have this warning about flashing lights. This can be one of the triggers, but it is important for me to mention this. Every patient will have different triggers. Some people will get more triggered by stress. Some people might be more triggered by alcohol. There are general triggers that should be avoided, but it really depends on the patient, and some patients will be more triggered from certain things, while others be more triggered from other things. So the triggers are, first off, flashes. Light flashes and loud noises is actually one of the triggers, obviously. Second one is stress. People who are stressed are more likely epilepsy patients who are stressed are more likely to have a seizure, as well as lack of sleep or hunger. These things can increase the chances of a person to have the seizure. And lastly, alcohol. Also, if I think about it, also lack of oxygen. And now this list can really go on and on and on because there are a lot of different triggers that can make the seizures happen. However, it really depends on the patient. These are the most common triggers that I can mention, and this is basically what you should know. Okay guys, and that is it. Now you guys know what is an epilepsy, what are seizures, what are the triggers for that, and how we can help our patient. I hope I blew up some myths and you learned more about epilepsy than you knew before. And that's it. I hope you enjoyed, and I'll see you in the next one. Bye guys.